welcome to this new SPHR webinar on health risk communication for public health. It's my pleasure to welcome Dr. Zsófia Demjén and Professor Elena Semino from the universities of UCL, University College London and Lancaster, who are going to talk to you and to us about their project, the Quo Vadis project particularly. So Zsófia is an associate professor of applied linguistics at the UCL Center for Applied Linguistics and specializes in language and communication around illness and healthcare. Includes humor, metaphor, narratives, and politeness, among other specialties. Her most recent projects have focused on the experience of hearing voices that others cannot hear, and how childhood vaccinations are talked about in different contexts. Professor Semino is a distinguished professor in linguistics and English language at Lancaster University and a co-director of the ESRC Center for Corpus Approaches to Social Science. She is a visiting adjunct professor at the City University in Hong Kong, an associate editor of the journal Metaphor and Symbol, and a fellow of the UK's Academy of Social Sciences. She specializes in health communication, medical humanities, corpus linguistics, stylistics, and metaphor theory and analysis. I hope I covered everything correctly. So without much further ado, I think I welcome Elena and Zsófia to present. The floor is yours.
Thank you very much. Hope you can hear me. Yeah. Okay, thank you very much, Marco and Amy, for organizing this. Zsófia and I are going to share this talk, so I'm going to do the first half, and she's doing the second half. Zsófia is also moving the slides, so any slight delay, please bear with us. So we're going to talk about part of the findings of a project that was carried out with ESRC funding in collaboration among several universities and the UK Health Security Agency, including Lancaster and UCL. And specifically, we're going to focus on some issues that we identified while analyzing large quantities of data with particular terms in relation to vaccinations, namely jab, shot, and side effects. So let me start with a little background, some of which you don't need. Okay, so vaccine hesitancy was identified by the World Health Organization as one of the top 10 global health threats before the COVID-19 pandemic in 2019. The WHO has a behavioral definition of vaccine hesitancy as a delay in acceptance or refusal of vaccines despite availability of vaccination services. Since then, of course, there's been an enormous amount of research on changes in vaccine attitudes. And there is evidence that things have got worse, not better. So, for example, the Vaccine Confidence Survey collects data from many countries around the world every couple of years. And in particular, with relation to people's degree of agreement with the statement, vaccines are effective. In many countries, there's been a decline, substantial decline in the proportion of people who say they agree with that statement since before the pandemic. So, for example, in the UK, for the age group 45-54, in 2019, 90% of people said they agreed with that statement. And in 2023, that percentage was 72%. Now, getting a little closer to us, we are linguists and discourse analysts. So our research tends to start from the observation that is shared outside of our field. Of course, the attitudes towards vaccines are well known to be formed and negotiated in discourse. So decisions are not made just by reasoning or in a kind of solitary fashion, but people talk about vaccinations, read about vaccinations, and online communication has been found to be particularly influential. So our project, funded by the ESRC, that's the next bullet point, was called Quo Vadis, Questioning Vaccination Discourse. We combined discourse analysis with corpus linguistics, which is the computer-aided analysis of large language data sets. And we started off, so our project was conceived just before the pandemic. So the project was funded to focus on childhood vaccinations in different kinds of data, including specifically from social media platforms, Mumsnet, Reddit, and Twitter, later renamed X. So on the next slide, in the interest of time, I'm going to keep it slow, keep it quick. That's the team. And then if we move on, here's the finding we have selected for the first part of this talk today. So some of our research using the methods that we have is kind of exploratory. We look at data, large quantities of data, sometimes in a kind of bottom-up fashion, without looking for necessarily specific things. And we, to some extent, stumbled across what might be described as a new form of vaccine hesitancy that arose during the pandemic. So because the project was intended to look at attitudes towards childhood vaccines through discourse analysis, we built a corpus of tweets, as they were then called, focusing on the MMR vaccine. So at the time before Elon Musk, can we have the next bullet point, Zsófia? Sorry. There was an academic API that allowed researchers to collect Twitter data for free. It doesn't exist anymore, but it existed then. And we collected tweets that included MMR and some form of vaccine, vaccination, VAX, etc. Meaningful numbers of tweets were identified from 2008 onwards. So we collected a corpus that spans the period 2008 to the end of 2022. As you can see, there are 260,000 tweets and just over 9.5 million words. As you can imagine, we decided to make a distinction between the pre-pandemic period, January 28 to December 2019, and the pandemic period, January 2020, December 2022. And as you can see, what we call the pre-pandemic subcorpus is just over 4 million words, and the pandemic subcorpus, even though it covers a shorter period of time, is 5.5 million words. This is partly because tweets became longer in that period, the character limit was increased, and partly because people tweeted more. Okay, so there were many things we could do with that corpus, but one thing we decided to do was to look at what happened when people mentioned the MMR vaccine, which the corpus was built around, and COVID in the same tweet. And specifically, we asked the question that you have at the bottom of the slide: what vaccine-related evaluations and topics characterize tweets that mention both COVID-19 and the MMR vaccine in, of course, the pandemic subcorpus 2020-2022. So this was a kind of open question: what happens? Okay, so one thing that you can do using the software that we have is simply find something and see how many instances you've got. So we looked for the string COVID wildcard that allows for just COVID or variants of what happens at the end of that word. And we found just over 26,000 instances in nearly 23,000 tweets. Okay, there were too many. We had too many tweets at this point to analyze manually. So we selected a random sample of 10% of tweets that contained COVID and, of course, MMR. And we coded them for two things: what we call vaccine-specific evaluation and vaccine-related topic. So vaccine-specific evaluation basically captures whether a vaccine, MMR, COVID, is talked about positively or negatively. So the codes were things like positive for both, negative for both, positive for one, negative for the other. Of course, some were unclear. Vaccine-related topics include things like efficacy, safety, and mandates, and tweets could get more than one vaccine-related topic. Okay, so in terms of evaluations overall, positive evaluations in our coding outnumbered negative evaluations. And actually, this was a consistent finding when we looked at social media data, that in spite of the fact that social media is often accused of supporting anti-vaccination arguments, generally speaking, we didn't find that. Obviously, we found anti-vaccination arguments, but they were never the majority. I should say that X is now quite different from the way Twitter was when we analyze things. So this may not apply. So overall, positive evaluations of one or both vaccines outnumber negative evaluations. But we focused on the most frequent evaluation that had a negative element. And that most frequent evaluation with a negative element was positive for MMR and negative for COVID. In other words, we had a substantial number of tweets where the COVID vaccines were evaluated negatively in relation to the MMR vaccine. So, for example, on the left-hand side, yes, because the COVID vaccine is just like the MMR vaccine. Not. MMR vaccine provides 99.8% protection from catching measles, mumps, or rubella. COVID vaccines does not stop you from catching COVID. And then the one on the right talks about people not being worried about meeting with people who are vaccinated against MMR, but worrying about meeting people who've been vaccinated with COVID because they might still be infectious. So we found that. And then more specifically, when people expressed this evaluation, sometimes they actually went one step further and basically said that because the COVID vaccines, compared with other vaccines such as MMR, were not good at preventing infection, therefore they weren't really vaccines. So here's an example. How about we start with the fact that it's not a vaccine, this about COVID, it's a therapeutic. The vaccines immunize you from a virus. The COVID, scare quotes, vaccine still allows you to catch COVID just with lesser symptoms, not the same with polio, MMR, etc. I think we have another example. Agree the definition of a vaccine is lifetime protection, like the MMR vax. This is more like a flu shot. I'll come back to shot that needs to be taken yearly when they try to guess which strain will be out. Of course, these people are not wrong in relation to the different ways in which the vaccines affect illness, but they go to the extent of saying that therefore the COVID vaccines are not vaccines. Okay, let's see where this comes from. This is not surprising. The prototypical definition of a vaccine that most people are aware of is that vaccines prevent you from getting the illness. And if you look at definitions from the UK Health Security Agency, the WHO, they all talk about immunity, becoming immune, reducing the risk of getting a disease. This does not apply straightforwardly at all to COVID and the flu vaccines. And in fact, in 2021, the CDC actually changed, adapted, revised its definition of a vaccine to focus on producing protection from a specific disease. A very useful distinction that my colleague, Professor of Medicine here at Lancaster, Rachel Isba, makes is between what she calls vaccine preventable and vaccine modifiable diseases. I find it really useful because it shows that the differences between vaccines are not to do with the vaccines, they're to do with the diseases they apply to. And she says some diseases are vaccine preventable, not 100% actually, but mostly like MMR, polio. But some diseases are vaccine modifiable, like flu and COVID. The problem is this was not something that most people were aware of. And in fact, I don't think it was ever fully explained, especially in the early days of clinical trials results. So let's come back to the word shot. On here, you've got some examples. On the left-hand side, you've got some examples from the US, and on the right-hand side from Australia, where shot is being used as an informal alternative to vaccine, especially in public health campaigns, inviting people to come to be vaccinated. Okay, so what did we find about shot, or the problem with shot in the pandemic subcorpus? Here are some examples. One person says vaccine. Polio, MMR, smallpox, you don't have to get them again and you won't get the disease. Shot, tetanus, flu, COVID, you have to keep getting them because they aren't a cure, because there is no cure, especially for coronavirus. Stop calling it a vaccine, it's a shot. And then you can see that with the others, don't call the flu shot we don't call the flu shot a flu vaccine. MMR is a vaccine, it is a COVID shot. The one on the bottom right with the 67% effectiveness rate, it is a shot, not a vaccine. Vaccines are 100% effective. So basically, the fact that the COVID vaccine was experienced as not very good at preventing infection led some people to regard it as not a vaccine and to use the term shot in contrast to vaccine. And this attitude, if you like, leaked into how people also talked about the flu vaccine as a shot. So we did a little analysis of shot in our corpus. So this is I'm just reporting, it's not just to do with what we found, but the relative frequency of shot is quite different in the two corpora. They're not the same size, but we can calculate the frequency per 1,000 words is 6.6% pre-pandemic and 14.6 during the pandemic. Another thing we can do with our methods is look at the words that co-occur frequently with a word of interest, in this case, shot, and we call them collocates. These are the top 20 collocates of shot in the pre-pandemic subcorpus on the left and the pandemic subcorpus on the right. If you click again, Zsófia, we can show you which words we decided, which collocates we decided to investigate. So for both corpora, we have flu, MMR, and vaccine that are particularly relevant and that we followed up. For the pandemic subcorpus, also COVID. Okay, what did we do? Initially, we took a 10% random sample for each collocate pair, so shot and flu, shot and MMR, etc. And we looked to see, we coded for whether shot was being used to undermine the status of a vaccine as a vaccine. We call them undermining uses. In this sample, there were no instances of the MMR vaccine being undermined by calling it a shot, and so we didn't go any further. But for the other collocate pairs, so shot with flu, vaccine, and COVID, we looked at all concordance lines to code for undermining uses. And this is what we found. Okay, so in this table, you can see the collocates in the leftmost column, vaccine, flu, COVID. Then in the middle, you have the pre-pandemic subcorpus, and on the right, you have the pandemic subcorpus. Below that, you can see that we've got figures and percentages for non-undermining uses and undermining uses of shot in that collocation pair. If you click again, Zsófia, we can see the undermining uses. So in the pre-pandemic subcorpus, there are only 13 instances where shot is being used to undermine the status of the flu vaccine as a vaccine. Obviously, COVID doesn't apply, and there aren't any instances in the shot plus vaccine collocation. In the pandemic subcorpus, in contrast, a substantial proportion of each collocate pair was identified as a case of the use of shot in contrast with vaccine, to undermine the status of a vaccine as a vaccine. You can see that it applies in just over 50% of cases of shot collocating with COVID, but it actually applies in 30% of cases of shot collocating with flu. So in other words, we have a little evidence of this happening with flu in the pre-pandemic subcorpus, but rarely, and actually a substantial proportion in the pandemic subcorpus. So the phenomenon we're observing, both in terms of the general skepticism about the status of some vaccines as vaccines and the problematic use of shot in contrast to vaccine, is a pandemic phenomenon likely arising from this experience of the vaccine not preventing infection very well, and then this attitude also leading to more skepticism about the flu vaccine. Okay. Now, we presented this finding at various points, particularly to audiences in the UK, and very often the reaction was, the reaction was very nice, but we were often told, well, yes, but shot is used by Americans. The Brits don't use shot, they use jab. And so after the main study, Zsófia led an analysis of jab in our data. Now, jab is actually, so jab, of course, is another informal alternative to vaccine. It's an informal term for injection. The NHS, in its style guide, actually discourages the use of jab for a vaccine, partly because the notion of jab can arguably make people increase the fear of people who are scared of needles. However, and you see it around you, it is quite common for local NHS trusts to use jab in public health campaigns, inviting people to get vaccinated. You've got here one for COVID, get your COVID jab, and one for flu, get your free flu jab. So it is used. What did we find in our corpus? So we looked at jab collocating with COVID in the pandemic subcorpus, of course, and we found in 18% of cases, jab was used to express the same novel skepticism. In other words, it was used in contrast with vaccine to suggest that some vaccines are not really vaccines. So here's a couple of examples. Oh, wait, until everyone finds out they've been duped into allowing an experimental witch's brew. Jab is not really a vaccine. No one is vaccinated. MMR is a vaccine. COVID jab is not. And in the other example at the bottom, the COVID jab is most similar to the flu jab, but it can be compared with the other vaccines. So here it's always difficult to draw conclusions about language use for every context. However, clearly both shot and jab have baggage, and clearly for some people they are not, they're using contrast with vaccine, and therefore this needs to be taken into account in deciding whether to use it and when to use it. I'm not suggesting that it should never be used, but at least people should be aware of what it might mean. Okay, just one final thing from me. Of course, the data we collected in the Quo Vadis project ends in December 2022 as part of a more recent EU-funded project about a slightly different topic. My colleagues and I have collected a corpus of posts in a subreddit called Vaccine Debates. Right now it goes until the end of 2024, then we collect the 2025 data. We haven't analyzed it for this, but I've done a quick analysis to see whether I could find the same phenomenon for shot and jab. And the short answer is yes, I found it without much difficulty. So if you go back again, Zsófia, for a second, here you've got somebody expecting working products to provide immunity for disease for 99% of the population to get something marketed as a vaccine, but the COVID is a shot like the flu shot. And in the other example, the same issue, the same argument is made for jab. I told them straight that she won't be having the COVID jab. I don't call it a vaccine on purpose. So it seems like this attitude is persisting beyond the pandemic. On the next slide, you have the papers we have published with these results. And now I hand over to Zsófia, who's going to talk about side effects.
I'm just unmuting. Thank you so much, Elena. So moving on now to a slightly different study, looking at how the term side effects is used, but still continuing with the theme of what might we learn from observing how certain terms are used when people just talk amongst themselves in relation to vaccinations. So one of the things that we were interested in the larger project that Elena introduced is the idea that sometimes even groups that are generally pro-vax can have concerns that are unaddressed. And one such group is the online parenting forum Mumsnet. So it's relatively well known as a vaccination-friendly space where any kind of discussions that are anti-vax or that include vaccine misinformation tend to be called out and removed. So this is a UK-based parenting forum, and of course it includes lots of information that Mumsnet themselves post, but it also includes a discussion forum, which is focused on all things to do with parenting, but includes discussions on childhood vaccinations and vaccinations that one might get during pregnancy. And so to think about this idea of what concerns might apply even when people are generally pro-vaccination, we ask the question of what characterizes vaccine indecision on a forum like Mumsnet. And for this, we used a type of keyword analysis, which allows us to compare original posts that involved indecision around vaccinations. So people weren't just talking about vaccinations in general, but they were wrestling with making a decision about whether to get vaccinated or to allow their children to get vaccinated or not, usually at a point where they'd been sent a consent form or were being invited to attend a vaccination appointment. And so we found 426 original posts like this, and we compared them to 593 original posts that were still about vaccinations, but didn't involve this need to make a decision in the given moment. And so when we compare these two sort of subcorpora together, the tools that we use give us the words that are statistically significantly overused in the data set that we're interested in, and we can then see essentially what is characteristic of it. So what characterizes vaccine indecision on Mumsnet? Now, there were a number of things that were characteristic of indecision in this kind of pro-vax sort of group. But one characteristic of indecision was concern about side effects, which maybe isn't that surprising. I mean, obviously, side effects would be the thing that concerns people. So the fact that this was an important concern was signaled by the frequent use of words like effect, reaction, harm, link, developed, and coincidence. So now, side effects in general are known as sort of unwanted outcomes that occur in the same range of doses as beneficial effects and through parallel mechanisms. So that's the technical definition. But it's relatively well known that the term is used in lay contexts, not just in the context of medicines and vaccinations, but that in these lay contexts, it is used much more broadly. In vaccine contexts, we know that the side effects that worry people can be vaccine specific or general. They can range from things like high fever, so relatively mild and generally feeling unwell, to adverse neurological outcomes like autism and even death. And I should stress that these are the concerns that people have. Not all of these are necessarily underpinned by scientific evidence, but it is something that worries people. On Mumsnet, the concerns that people talked about kind of mirrored this general spread. And concerns were mentioned in a number of different ways about side effects. For example, are the possible side effects of the jab worse than the side effects of any flu that I could get? But what became clear is that it was mostly not clear exactly what effects or what symptoms were of concern. So what are the specific symptoms that people are worried about? Is it the sore arm and the fever, or is it autism and death, or anything in between? Now, in Mumsnet, when we looked more closely, the exact nature of side effects, in fact, was not specified in about 90% of the cases. And that broke down into two subcategories. So in about 60% of cases, when people said the term side effects, they use it completely generically, like in the example that I showed you, the side effects of any vaccine or the side effects of any flu. And in a further 30% of the cases, there was a sort of usually an adjective, some kind of vague qualifier, such as a serious side effect or a long-term side effect or a mild side effect. So that gave us a little bit more information, but it still didn't tell us specifically what symptoms were of concern. This prompted us to ask the question whether this is actually just something specific to Mumsnet and this generally pro-vax community, or is it something that applies more broadly in online discussions of vaccinations? So we asked the question, how are the terms side effects and its variants used in discussions of vaccinations on different online platforms, and what implications do these usage patterns have for vaccine hesitancy? And to answer this, we used further data sets from the Quo Vadis project. We had our Mumsnet corpus, which we broadened out the search. So we didn't just look at indecision, but we looked at how the term side effects is used across Mumsnet vaccination discussions. We also looked at the Twitter MMR corpus that Elena talked about in the previous study. And we also had corpora that were specific to HPV, both from Twitter and for Reddit. And we used those as well to look at 3,000 examples of the term side effect in its various sort of spellings across these three platforms for corpora. And we coded a 10 to 11% random sample of these instances, except for Reddit, which was our smallest corpus. And there we actually coded all instances of side effects to see how they were used. I'll just briefly go into the coding. So the first question we asked was whether the use of side effects refers to vaccine side effects or not. That was an important distinction since we were interested in vaccinations. And when it was in reference to vaccines, we then asked, is the side effect being talked about in specific ways, generic ways, or qualified ways? So the distinction between specific and generic is very simply, do we have an idea of specific symptoms that are concerning people that are being referred to as side effects, or do we not? So side effects of the MMR are death, deafness, autism, and measles. That would be an example of a specific use of side effects because the text gives us an idea of what symptoms are of concern. Versus if my son has side effects from either vaccine, are they likely to be multiplied by having both vaccines together? In this case, this is a generic use because we have no further information about what kinds of side effects might be of concern here. When side effects were qualified, we coded how they were qualified. So were they qualified for severity? For example, in the use of the HPV vaccine is dangerous or that it causes serious side effects for the vast majority of people. So that would be an example of severity. Mild side effects would count here as well. Sometimes side effects was qualified in terms of a time frame, temporality. There's never been a vaccine with side effects that only show up long after immunization. So this usually referred to either how long side effects might last or how long after vaccination they might show up. Sometimes side effects was qualified in terms of frequency, so extremely rare, not common. 99% of the vaccine recipients have no side effects, so words like rare and common would count here. And then we had a slightly ambiguous category of negativity, which often shaded into severity, but wasn't clearly about severity and mildness. And these were examples such as I had unpleasant side effects after dose 1, virtually none after dose 2. So today I want to focus on the distinction between specific and generic references. And in terms of qualified references, I want to focus on severity and frequency because these have most relevance for how we talk about side effects in kind of a public health communication context. So very similarly to what we already identified on Mumsnet, generic references to vaccination side effects were the most common across all the corpora that we looked at. So you have a few examples here. Yes, vaccines do have side effects, but it's a numbers game. The vast majority have MMR, tetanus, and other vaccines. The shot you want them to have, just to go back to the previous example as well, the shot you want them to have doesn't prevent you from getting the disease, doesn't prevent you from carrying it, doesn't prevent you from spreading it, and has more side effects than all other US-approved vaccines combined. Cheers, my mother-in-law, mid-60s, who had the vaccine yesterday, didn't have a single side effect. So it's worth pointing out that when we looked at the term side effects, we didn't only focus on ones that were hesitant. So sometimes these were pro-vaccination sentiment, expressing pro-vaccination sentiment, but nevertheless, we were interested in how the term is used, right, regardless of the context. And then the final example, HPV vaccine is fraught with too many side effects. I do not recommend it. So in these examples, as I said, we don't know what specific symptoms are of concern, but it's worth just noting that sometimes they mention that there are many side effects, and I'll come back to this at the end. When we saw specific references to vaccination side effects, and these were second most frequent in Mumsnet and the Twitter MMR corpus and least frequent in the 2 HPV corpora, what we noted is that the range of symptoms that were being described was very, very broad and was expressed with varying levels of specificity. So, for example, there was, there were side effects I expected, and then a list: headache, temperature, sweating, sore arm. Alternatively, sort of at the other end of the spectrum, we have examples like bizarre side effects like paralysis and epilepsy. So sometimes quite specific diagnostic criteria, sometimes expressing quite extreme side effects, and other times more colloquial expressions like temperature, sweating, expressing relatively mild effects. Come back to the importance of this. When we found qualification in terms of frequency, the interesting thing was that this type of qualification was the least frequent in each corpus. So we have some examples, for example, say 1 in 100,000 or whatever, giving a very specific number for how frequent side effects are. or 99.9% of vaccination recipients have no side effects. We did find this on occasion, but it seemed to be the least salient for people in general, because this is what they mentioned the least often. By contrast, qualification by severity was the most frequent across all 4 corpora. Don't get me started, one of my kids had full-blown measles from the MMR, but apparently they didn't because vaccines don't cause illness, just minor side effects. Study of 1 million girls in Denmark and Sweden, no side effects, no evidence of link with major side effects after the vaccination. And then we have more examples of severe side effects, serious side effects. So when people mention something a lot, it suggests that that is either most important or most salient for them in general. Now, so what? Why do we care about all of this? Well, as in the previous analysis, we can see that about 70 to 85% of references to side effects are either generic or qualified across the corpora, and arguably both of these are vague or ambiguous because the qualifiers that tend to be used are often gradable adjectives, which have a meaning, but it's a relative meaning. It can mean something else for everyone who reads it. When specific side effects or specific symptoms are mentioned, so there is a specific use of the term side effects, in that case, the range is very broad. And this sets the limits of interpretation quite wide and arguably contributes to a sense of vagueness or ambiguity or confusion about what we mean when we say side effects. Now, this has important implications because if I'm not necessarily writing about something, but I'm going online to read about vaccinations, then when I read posts that are vague or ambiguous about what they mean when they say side effects, I can superimpose the concerns that I'm bringing to the text much more easily. I can read the concerns that other people have about side effects as being concerns like mine, which can give potentially unwarranted legitimacy to my own concerns. Some of these, as I said, may not be backed by science. So I may feel like many more people share my concerns than actually do. If we think about the contrast between qualification in terms of frequency and severity, the idea that severity might be most salient for people and frequency might be least salient for people is important because official information on vaccination side effects, for example, on the NHS web pages, tends to be organized by frequency, not by severity. In fact, most often, there is no direct information about severity presented. So the way that people who might have concerns and go to official sources encounter information about vaccine side effects does not necessarily immediately align to how they think about it most saliently. Why is this important? Well, a person who has no serious concerns about vaccinations and has a reasonable trust in health authorities is likely to assume that common side effects are also mild because otherwise the vaccine wouldn't be in use. However, if someone is concerned or maybe doesn't trust health authorities or governments quite to the same extent, would they necessarily make the same assumption? Arguably, the answer is no. And in that case, the official health information that we would hope people go to isn't organized in a way that might help allay their concerns. Finally, I just want to return to this idea about the generic references to vaccinations and that some of them highlight the idea that the number of side effects listed for vaccinations is a source of concern for people. Now, one approach to this issue is to reduce the number of side effects listed with vaccinations. And this seems to be what happened when the NHS recently, I think it was in 2022, revamped its vaccination pages. It kind of streamlined, standardized across different childhood vaccines and reduced the information that's visible kind of on the first page that people click onto. This is great. It contributes to clarity. And of course, full information is available one click away. But there is a risk in this strategy of fueling conspiracy theories, and it's something that we found evidence of in our data. When something similar happened in India, then people talked about the government hiding the harmful side effects of the HPV vaccine. So it can be perceived as hiding the information. An alternative strategy could be for official sources to distinguish between the different kinds of things that can happen after vaccination. Perhaps there is justification for differentiating between effects that come from the vaccination process, like the needle going into someone's arm, right, which might cause a sore arm or redness, or if you're afraid of needles, might cause fainting. Then effects of the body mounting an immune response, such as fever and tiredness, and genuine side effects, which might include allergic reactions or blood clots, and so on. And this is not just our suggestion. This is coming from what we found in the data itself. This suggests that that people might be thinking about side effects in these terms already. For example, I don't think that sore arm is a vaccine side effect. It's a side effect of the injection. Or depends on what you categorize as a side effects. Most will have a sore arm with a flu vaccine, but the truly serious reactions are pretty rare. So you can see that people already by themselves make a distinction between the different things that can happen after vaccines, and perhaps there is room to work with this and to expand and clearly delineate as far as it is possible between the different things that can happen after vaccines. This could reduce the list or the length of the list of side effects that we have to outline. If you want more information on this, some of this work is included in this particular publication. The rest is still under review. But overall, through the two studies that we presented, what we hope to have shown today is that there is real value in looking at how people in authentic, unelicited contexts talk about vaccinations or potentially other health interventions amongst themselves. The way that people naturally communicate can provide sources of evidence for what we might want to avoid, such as jab and shot, but it can also provide sources of evidence for how we might reconfigure the information that we do provide so that it aligns better with how people already talk or potentially even think about the intervention in question. Thank you so much.
Excellent. Thank you, Zsófia and Elena, for this very, very insightful and interesting presentation. Yeah, if there are any questions, put them in the chat. Otherwise, you can also unmute yourself and probably speak up if it's easier. While we wait for someone to intervene, I have several questions because it's very much something of my interest, especially recently and after the COVID-19 vaccination pandemic, infodemic also. When it comes to misinformation, so I wanted to have your view about the volume of misinformation that is out there. I mean, you have a large corpus. I know that you didn't classify what is correct and what is wrong, or what is misinformation or disinformation, but can you give us some idea about what are the misconceptions that are present in this narration about vaccines?
Elena, do you want to go?
Oh, you go first and I'll follow.
I suppose you're quite right, Marco, that we didn't specifically look for misinformation, disinformation. I suppose one of the examples that we did find was potentially this misconception about what vaccines are for, but that wouldn't necessarily count as misinformation. It's just it just reflects that perhaps, I mean, education is never the solution to these things, but there perhaps isn't a general understanding of the different things that vaccines might be able to do, like Elena outlined. We have evidence of sort of some of the conspiracy theories coming back. So we did find, even on Mumsnet, evidence of the Wakefield controversy and the link between autism and MMR being kind of recycled, reused, much less frequently than sort of in the beginning of our data collection period, sort of in the early 2000s. But nevertheless, there is a bit of a long tail to that. And I suppose in some ways, online environments where people can go back and read discussions from many years ago can potentially exacerbate that because a thing just doesn't go away, right? It's still there. So these are some of the main things that we found. Elena?
Yeah, we looked, we did a couple of studies on the HPV vaccine, and especially reasons why some parents may be reluctant to have their mostly daughters in a data collection vaccinated. And we did find evidence, for example, of the belief that the HPV vaccine is really only for people who are sexually promiscuous. And so, you know, if your child is either far away from becoming sexually active or is not going to be promiscuous, then the vaccine is not for them. You can just do screening and it's the same, it leaves the same result. So some of these things are kind of basically examples of misinformation. The thing with the shot and jab that complicates things is that actually mostly people generally make an observation that is correct about how different vaccines work. So they're right when they say, well, you know, if you have the MMR, if you take the MMR, you don't get measles, but if you get vaccinated against flu or COVID, you can get. So they're right about that. But then they draw the wrong conclusion that it's some kind of the COVID and flu vaccines are inferior interventions and therefore not worth having, and the people are being cheated into believing they're vaccines. So there's a kind of shade. It is true we never looked for just this information. It's very difficult to look for just this information, but we found different kinds of, if you like, beliefs that we might describe as reflecting misinformation, and some of them are nuanced. They're not necessarily straightforward, one thing or the other.
I like the way you differentiate vaccine modifiable and vaccine preventable. And I was wondering, maybe we need a campaign about this distinction. So instead of saying, well, let's talk about HPV, MMR, COVID, flu, and so on, maybe we should just start, from a public health perspective, saying we need to clarify things. We need to explain the difference between these things so that we correct this belief or misconception around the expectation that come around.
Yeah, the distinction, the credit goes to my colleague Rachel Isba, who's a professor of medicine at Lancaster and a pediatrician in one of the hospitals in Manchester. She introduced it to me. I've asked her if she's ever written it down, and she said no. So she said she's happy for us to use it, and we have used it. But yes, the distinction between vaccine preventable and vaccine modifiable diseases is great. There is a campaign in the US that has now been stopped by the current administration for the flu vaccine, which is called From Wild to Mild. If you look it up, you'll find it. And basically what it does is it has the images are all based on, say, you have a kind of cartoon with a shark, and that's the wild flu without vaccination. And then at the bottom, you got goldfish, and then there's endless variations. And that is the one campaign, the only campaign that I've found that emphasizes how the vaccine modifies the disease rather than prevents it. But yes, that distinction to me is crucial.
Indeed. Okay. There's a question from a chat from Milo about shot and jab. How did you filter out or handle other non-medical senses of the words during corpus analysis?
Yeah, that's a very good question. You can't filter them out straightforwardly. However, because we looked at collocate pairs, so we looked at shot being in close proximity to either MMR or COVID, then the proportion of, if you like, false positives was very small. And also bear in mind that our data sets are focused on vaccinations, and so you're more likely to get the kind of medical sense of shot. So for us, it wasn't a big problem. But if you were looking in a very general data set that has a whole range of topics, then of course, yes, you would find all sorts of uses that are just not relevant to your analysis.
Excellent, thank you. Thank you. There's a thank you from Milo in the chat. I have another question about visual the visual formats of social media content. I know you're focused on Twitter, so on textual, but what would be the way you would analyze videos, for example? Would you analyze a transcript? How would you approach that? As a naive, this is a naive question, sorry, for non-expert in discourse analysis.
Yeah.
And
Do you want to take that, Zsófia?
Yeah. So like you said, for the verbal content, what we would do is create a transcript and work on the transcript. For the multimodal content, there are ways of creating multimodal transcripts as well, which facilitate analysis. It doesn't necessarily, I mean, there are sort of attempts to do a corpus analysis that is multimodal, but it's much more difficult and complex to do that. So that usually the multimodal kind of analysis would be done on a much smaller scale, looking at samples. But there's something called the visual grammar that you can use to work out different elements of visual images that might be used on Instagram, for example. There are concepts in multimodality to do with coding the moving image. So yeah, there are some tools for that. It's not necessarily the tools that I would certainly use most of the time, simply because I'm focused on verbal language.
Yes, absolutely. I see. So this brings me also to the idea of now the content of social media. A lot of content is generated by bots and generative AI tools. How do you see the future, let's say, of communication around those health-related topics when the content is somehow generated in an uncontrolled way?
Yeah, that's a very good question. I don't know, but I suppose from our point of view, if for the kind of data collection that we do, once it's out there, and people can read it. And so from that point of view, some studies, it doesn't matter how it was generated. And in fact, it's quite possible that there are bot-generated tweets in our data. But they're out there, they can be read by people. And therefore, we try to collect data that reflects not just what people are saying, but what people are reading. Beyond that, obviously, there are tools for identifying AI-generated language. It's certainly not my own specialism, but there are colleagues who do that. And if somebody wanted to try to distinguish, they would do that. When I've worked on basically survey type data, where usually somebody else leads the study because it's not my specialism, and there are ways in which my colleagues sort of introduce different ways of making sure that in the responses to the survey are not automatically generated. But that's going to be a challenge depending on your research question as time goes on.
What are your next steps? Let's say your future research projects on this domain. How would you expand on this Quo Vadis? What are the next steps for Quo Vadis?
Zsófia, do you want to go first?
I mean, Quo Vadis itself is finished. One of the things that would be fantastically interesting is to look at how on the same kind of social media platforms, the discourse is changing as a result of what's happening in the US, right? So that's having a profound impact, because what we're now seeing is that, to go back to your early question, disinformation, misinformation now coming from traditionally legitimate sources, right? From health authorities. And so what is the impact of that? How do the patterns that we found replicate or change across time? The problem with that, Elena mentioned one of those, is that, for example, on Twitter, right, it's not just the discourse in the US that's changed, but actually the social media platform has changed. Not only because you no longer have the academic API, so no longer have the ability to download tweets in the same way, but also because of how the algorithms work to promote or not, background certain types of content. So at the moment, we have talked about this and we've thought about it, but we haven't quite worked out a way of how we could actually do it because of all these other changes that are happening. But obviously, there are other ways of taking things forward. Elena, do you want to?
Yeah, I know. I've been because I'm interested in metaphor. I've just finished writing a book on metaphors and vaccinations that covers the pandemic period, but also since then and before then. And so I'm doing more work on that. And then the data, the slide that I had with the examples from 2024 on Reddit. I'm part of a project, a European project that's actually about pandemic preparedness. And as part of that, we built a Reddit corpus where we wanted to look at hospital-based, how people talk about hospital-based clinical trials. But within that data, there are also discussions of vaccines, as you saw. It's not the top priority of the project, and so not my current top priority, but that has some potential. But as Zsófia said, things have changed considerably in public discourse because of the US administration. Even though there are now counter tendencies, and in the US, there's some evidence that actually people are not being put off vaccinating as much as you would expect. But that definitely is an important change that has happened, yes.
Okay, right. Thank you. We have a few minutes to spare. So I think if I don't see other questions, I think we can thank the speakers for joining us today, and
thank you for having
us. Very insightful presentation, very insightful webinar on the different meanings also of jab, shot, side effects for vaccines. Thank you so much again for coming with us today.
Thank you for the invitation.